Hello, my name is Jane Ford. I'm a Regional Clinical Manager with Jigsaw, and today I'm going to deliver a presentation to give an overview of Jigsaw as an organisation, the services we provide both online and in the community, and the nature of our roles and our teams. Just to start off with, just to give an overview of what Jigsaw is and what we do. Jigsaw is a youth mental health organisation based in Ireland. We provide mental health services to young people aged 12 to 25 years old across the country. We're very much value-based. So some of our values we've listed there in terms of we value young people. They're at the heart and centre of everything we do. We show compassion to young people, their parents, their guardians, family members in our support to them. We consider ourselves quite a progressive organisation. We're a relatively lean organisation, and that means we can be creative and flexible in terms of responding to what young people need around their mental health. We consider that we act with integrity and that we work collaboratively, which means that Jigsaw generally develops in communities around the country, and we very much like to be part of the community, part of the solution, so part of the landscape around mental health services, and therefore we work very collaboratively with stakeholders, which include young people and their parents and guardians, but also schools, GPs, other professionals, youth and adult, child and adolescent mental health services, adult mental health services, etc. And that's really important. Jigsaw also has a strong research and evaluation department, and we're very much driven by evidence. So we can check in terms of what we're doing, what we're delivering to young people to make sure that it is yielding the best results it can. And you'll get a flavour of that hopefully in today's presentation. And we very much value diversity. So we really want to make sure the services we offer young people are fit for their different needs. And we also value diversity in terms of our staffing as well. And we very much welcome diversity. Together 2022 to 25 is our organisational strategy. It sets out our purpose and focus over the next 4 years. So that's available on our website, jigsaw.ie, if you want to have a deeper read of it, and very much like sets out our vision, which is in Ireland where every young person's mental health is valued and supported. And it really goes through how we aim to achieve that. So as I said, you can read a little bit more about that on our website, jigsaw.ie. A little bit more about Jigsaw. We are based at the primary care level of interventions. This means we sit alongside primary care services such as GPs, public health nurses, community setting primary care, social work, primary care psychology, etc. We're very much accessible. Generally in our community-based services, we're based somewhere in a central location within a town or a city. Nearly a high street location, so to speak, and young people and their parents, guardians can actually directly self-refer. They don't need to be referred by a professional, although we do accept professional referrals also. The age range is 12 to 25 years old, and we very much value youth voice and engagement. We have Jigsaw Youth Advocates, who are a group of young people who are interested in supporting young people's mental health, and we have a group of those in each Jigsaw service we have. And they very much inform and guide us in terms of making our services as accessible and appropriate for young people as possible. We consider we have good variety within the clinical roles. So I'll talk through this today, but basically there's clinical input, that's the bulk of the responsibilities a clinician will do, but there's also opportunity to get involved in youth mental health promotion and more outward facing work as well. We very much, as I said, consider ourselves in the centre of communities. We want to work with our community partners and other stakeholders, and so engagement with communities is really important to us. We work in a transdisciplinary manner, which I'll explain as we go on, and a couple of slides around that, which is a little bit different to what may be more familiar in the mental health landscape, which is multidisciplinary teams. And Jigsaw has 13 services across the country in community services, and we're all connected and we work together as a national network. And so that can be quite nice, that collegiality, and to meet other people from different counties. In terms of how we understand mental health, in Jigsaw, we do not diagnose, and we take a non-medical approach. Instead, we take a kind of a broad contextual view of personal distress, and we move beyond concepts of illness or disorder. Our goal is to work with young people to help in the understanding of what's going on for them and what they may need to do to work out of that or to work beyond that. So it's a collaborative process that happens between the clinician and the young person, and hopefully brings the young person to better understand what's going on for them and also the clinician gets an insight as well, and that helps build on the intervention that's delivered to make sure that it's fit for purpose. These are our service locations. So you can see we have 13 sites in the community. And if you want to find out a little bit more about where they are actually based in the communities mentioned, you can actually just check that out on the jigsaw.ie website. So for example, Jigsaw Donegal is based in Letterkenny, Jigsaw Offaly will be based in Tullamore, but you can find out more about the exact locations, as I said, if you go on the website. We also have a Jigsaw online team, which we're recruiting for as well. And they are based in Dublin 2 in our Jigsaw National Office in Westland Square. If you were to work with one of our community-based sites, this will be a kind of a typical team that you will be working in. So we work in a collaborative leadership way. So this means you generally have at least one clinical manager, sometimes two clinical managers in a Jigsaw team, and they're the clinical lead of the service. And then you also have a service manager who is the operational lead of the service. And those people work together. So we call them the local leads, and they work together in a collaborative way to achieve the aims of Jigsaw. Underneath the clinical manager, we have clinicians, and we have a senior Jigsaw clinician. The number of senior Jigsaw clinicians and clinicians per team is based on the size of the service. Typically, you would have at least one senior Jigsaw clinician. You could have up to three. In terms of senior Jigsaw clinicians. In terms of Jigsaw clinicians, again, you typically have 3 or 4, but you could have up to 6 in a very large site. So the clinical staff deliver the clinical interventions primarily within the service. And then on the operation side of the house, you have the service manager, as I said, who is the operational lead, who may have some line management responsibilities, also oversees premises, budgets, and would have maybe a greater linkage into the community outward facing work. And underneath them, you have a youth and community engagement worker who specialises in that outward facing work, delivering workshops, working with schools and community partners. And they also take a lead role in supporting the Jigsaw Youth Advocates Service. And then, of course, we have a very valuable service administrator. So we definitely have one service administrator per service. Some services have 2, depending on the size. And they are the first line of contact with young people and their parents and professionals who are trying to refer in, and they link in with them. And they're obviously a tremendous support to the clinical team in terms of scheduling and in terms of ensuring that young people can access the service in a efficient and effective way. And all those people are based on site in a Jigsaw service in one of the locations we spoke about. We also have regional management, and they are typically not based on site. They are responsible for a number of services together. And again, you have the clinical side of the house and the operation side of the house, and they have, I suppose, oversight and governance of each service. So you can see that that's just a flavour of the lines of governance that would be established within Jigsaw. In terms of the model of intervention that we deliver, Jigsaw offers a brief intervention model. So typically young people access about 8 sessions, 3 to 8 sessions generally. Some people may have more or less depending on their needs. That's decided between the young person and the clinician. Young people, once we accept a referral, they proceed to have an initial screen. This is like a mini assessment, so to speak. The young person is brought into the service, and the parent also, if relevant, if appropriate, depending on age. And the clinician meets and greets the young person, engages with them, sets out consent and confidentiality, and gives them a sense of what we do in Jigsaw. And the young person tells the clinician a little bit about what's going on for them and what they would like to work on. And by the end of the session, the clinician is able to decide with the young person whether Jigsaw is the best fit for the young person to come to, or if not, alternative options that might be signposted or referred on to. Following that, if the young person does attend Jigsaw, then they will proceed to a HEADS assessment. This is a more in-depth assessment tool. HEADS stands for Home, Education, Activities, Drugs and Alcohol, Sexuality, and Signs and Symptoms of Mental Health. And this is a more in-depth, as I said, assessment, and the young person will have an opportunity to highlight areas of their life that are relevant to the intervention and that they may want to work on. And this will help inform their goals for the intervention, and also how the clinician and the young person might conceptualize what's going on for the young person. And throughout, the clinician is always risk assessing and managing any risk that emerges. and also starting to build on the conceptualization, the picture that they and the young person are building of the young person. The clinician then may consider what therapeutic modalities would apply in this instance. And the clinician then delivers the intervention over the course of the remaining sessions, and on summary on the end, the clinician and the young person evaluate how the intervention has gone. They'll check in on goals that were set, have they been reached? They might talk about next steps, and the young person then typically completes their work in Jigsaw. Some young people may move on to other services, but generally young people, it's a discrete piece of work and they finish their intervention at that point. Jigsaw is open to young people to use more than once, obviously bearing in mind that the age range is 12 to 25 years old, which is quite a big age range. So a young person might use the Jigsaw service a number of times across that time span. As well as clinical work, we also, as I said, deliver youth mental health promotion. So here's a selection of some of our mental health workshops. These workshops are delivered between the youth and community engagement worker, and also some of our clinical staff will deliver this too. And as you can see, some of these workshops are around supporting young people to look after their own mental health, and then other workshops are around interested others such as parents, guardians, school teachers, professional coaches, to support the mental health of young people in their life. In terms of who works in our clinical teams, this is a list of who is eligible to apply for a clinical role in Jigsaw. As you can see, we have social workers, occupational therapists, mental health nurses, psychotherapists with certain accredited bodies, and you can check that out in the job description to see which bodies are listed. Psychologists from clinical counselling and educational backgrounds. So a person becomes eligible for a clinical role by being from this discipline, but then once they start working with Jigsaw, they work in the role of clinician or senior Jigsaw clinician. And we work in a transdisciplinary way. So we may be familiar with multidisciplinary, which is where a team is typically led by psychiatrists. There's defined as disciplinary roles, which is basically that a social worker works as a social worker, an occupational therapist works as an occupational therapist, and there's a separation there. They typically have supervision from somebody of their own discipline. And there's kind of an emphasis, I suppose, on what's different about the different disciplines on the team. In Jigsaw, we work in a transdisciplinary way, which means that any of those disciplines that I've just listed can take the lead. So they can be the clinical lead, and they're eligible to apply to be the clinical manager. Our roles are based on what we share in common, our commonalities and our shared competencies. And with this in effect, that means a clinical manager may be of a different discipline to you. So for example, you may be an occupational therapist and your clinical manager may be a psychologist, and that's how we work. And the emphasis is very much on shared skills and competencies. Although we do respect and appreciate differences, we're very much around working in this collaborative way, being respectful of what we can all bring to the table. And that's how we work in the transdisciplinary way in Jigsaw. In terms of how that is experienced, I suppose, by our clinical staff, we completed a survey with the clinical staff in 2019, and very much the feedback was that it was a positive experience. They learned a lot from different perspectives, and they didn't feel that there was a professional hierarchy, which can sometimes exist on MDTs. They also built a greater awareness of other disciplines, and they felt that it enriched their case conceptualizations and interventions. They did acknowledge, though, that it is a different way of working, so it's not maybe overly typical in the mental health landscape. So it's a bit different. It can take a bit of time to adjust. And one may have some anxieties around moving away from their traditional social worker, occupational therapist or nursing role. And on the whole, though, it's felt that the benefits outweigh any of these anxieties or adjustments. And I suppose Jigsaw has been practicing this way of working since it started. And we find it very successful. And I suppose the plan is to continue in that way and support any staff who join us to adapt to that and to work in this way as well. So that was a little bit about our community services. I'm just going to give you a sense of our online service too, which is jigsaw.ie, which is also recruiting for staff. So this is our current, it's our latest online therapeutic offering. It was launched in June 2020. Young people who want to use our Jigsaw online service just register on the system. They provide basic demographics and an email address. So in that way, there's a high degree of anonymity and autonomy. Our community services are based normally within certain counties or catchment areas, and young people who live, work, or study or have a GP can attend from those areas. Jigsaw Online is different in that it covers the entire country of Ireland. So a person anywhere in Ireland can use the service as long as they're 12 to 25 years old. We offer 3 distinct options on this Jigsaw Online service: live chat, email, and group chat, and I'll go through that in a moment. And we also have a good website with psychoeducational content and resources. Just to flag that the scope of practice of Jigsaw Online is slightly different to what we offer in our community services. Being as it is an online offering, we find that people often use it in a more ad hoc way. They dip in, they dip out of it. And you may find that some of the profile of the young people who use the online services may be slightly higher than what we find in the communities, just by its nature being online and a little bit more autonomous. That's okay, we work with that, and you'll get induction and support around supporting young people who fit that profile. But just the fact that it's slightly different to the scope of practice that is in the community, which tends to be more mild to moderate. So the first thing that we offer on Jigsaw Online is called one-to-one live chat. In this way, this is a web chat or kind of instant messaging where a young person can log on. They get connected with a clinician, and they're allocated about 40 to 50 minutes per session, and they can just engage and they can just chat through what's on their mind. And basically the clinician comes back with therapeutic support, active listening. This is all instant messaging, typing it into the computer. And, the young person, it's just a correspondence. They just interact with each other for that period of time. And the clinician can also offer some guidance around alternative supports or signposting. And young people tend to find that quite helpful. And that's open for a certain period of time, Monday to Friday. Online group chats then are more, I suppose they're geared towards a number of people at one time. So they're not one-to-one. And in this space, a clinician facilitates a group chat with a number of young people who register and log on. And they're generally teams. So they might be teamed around anxiety, or say, for example, this one was coping with stress. And the young people log on at a certain time. And there's nice interactions there between the people who are attending, the young people who are attending, I suppose kind of peer support in a way. And the clinician then moderates that and facilitates the chat to kind of keep it moving in a nice direction, maybe offer some support and whatever is kind of looked for in the group, the clinician will come in and work with that. And they are held, so they're not the one-to-one, they're held and they're facilitated around certain themes as they come up. And then young people can also access Jigsaw Online through email. And that is basically they can email anytime, 24/7 really, and basically outline anything they want to outline. And typically young people might just tell a little bit about what's going on for them, their stories, they just want to be heard. And they might be looking for certain advice or guidance, maybe around a relationship issue or something to do with school, for example. They put this all out on paper and in an email. Clinician picks it up then the next time they're in work. So for example, a young person might email that 2 a.m. in the morning, for example, that's okay. Clinician then picks it up when they're in work, and they respond to what is in the email. So they respond in kind. So if the young person, basically they use active listening, they might offer some solutions or guidance. It's very strengths and resilience focused, and then also any resources or links to other websites that might be useful are also sent to the email. And then we have our Jigsaw website, which is obviously open 24/7. And this is for young people to use, parents to use, teachers to use. There's lots of resources and articles and videos around mental health and supporting young person's mental health on this website. And jigsaw.ie is the link for that. So that's a quick overview of what we do in Jigsaw and our clinical roles. We currently have a large recruitment campaign for clinicians and senior Jigsaw clinicians. And so if you're interested in this, the clinical roles that are currently advertised are Jigsaw clinician. And to be eligible to apply for that role, you just need to be in one of the disciplines I already spoke about in terms of who we employ. And you don't need any postgrad experience to apply for a Jigsaw clinician. You just need to be registered or accredited as outlined in the job advertisement. For a senior Jigsaw clinician, then a person needs to have 3 or more years experience and postgrad experience to be eligible for that role. And you'll be able to find out more about that in the job description. And those are the roles we're recruiting for now in the current national campaign. And they are all across community-based services. The intention is to fill a panel. So there may be certain vacancies already in some of the services, and they will be filled as they arise. If there isn't a vacancy in your service of choice at the moment, you can be put on a panel, and then as a vacancy arises, you can be offered that at a future point. We are also recruiting for Jigsaw Online as well. So that's important to apply for too, if you have an interest in that area. And there's full and part-time options available. Just to say as well, we are not clinical managers. They are the clinical lead of the service, and we do recruit them, but we recruit them on a bespoke individual basis as the vacancies arise. So just keep an eye on the jigsaw.ie website, and you will see that there may be clinical manager posts come up as vacancies arise. And if so to apply for that, you need to have 5 or more years experience. They don't normally come through the national campaign, the big annual national campaign. They come up as the vacancies arise. So keep an eye on that if you have an interest in a clinical manager post. And if you do join our team in Jigsaw, we can offer a lot of support and development for clinicians. We have a very thorough induction program, first of all, when you start, and to make sure that you are settled and happy and content in the role, and that you feel confident proceeding to offer support to young people. So we have, as I said, a comprehensive induction, and we also have a strong internal clinical CPD, continuous professional development program, which is ongoing. So we typically have training. We have very strong actually speakers employed within Jigsaw who are very knowledgeable on many areas of mental health, who would often lead CPD programs. And we also bring in external speakers who can speak to certain themes. So for example, we would have done CPD on trauma, working with trauma, compassion focused work, eating difficulties, that kind of thing. Employees are also eligible once they pass probation to avail of an individual CPD allowance for external events. So that might be short day courses, for example, run by the Irish Association of Social Workers or PSI, or kind of short half day or full day trainings. That's something you can apply for an allowance towards that. That's a yearly allowance. And then we have a bigger support package of an education training support package that's up to €800 and 5 study days. And this is typically for maybe a postgraduate course, postgraduate certificate or diploma, for example, that is in keeping with the work we do in Jigsaw. And you can apply for that. And if that's supported, you can get up to €800 towards the cost of that. Jigsaw also provides regular supervision. So a clinician, a clinical member of staff will get at least 3 hours supervision per month. That's typically 1.5 hours individual and 1.5 hours group with other people of your role within your service, so other senior Jigsaw clinicians or other clinicians. We also provide quarterly discipline-specific supervision, and that's where on a quarterly basis you meet with everybody of the same discipline as you within the network, and you have a nice space for reflecting on your role and what it brings to Jigsaw, and I suppose to view the work you do in Jigsaw through the lens of your professional discipline. And we offer them on a quarterly basis. We also have Jigsaw Learning Networks, and that is where you meet with other people of the same role as you across the network. We come together at least 1 day a year for that. It's a lovely space for connecting with other people from different services, learning any updates that are going on in the network generally. There might be some space for training as well within that. And it's just a nice space to kind of link in with other people in the same role as you. You might be based in Dublin 15, but it's an opportunity to meet with somebody from Donegal, for example, and share experiences and commonalities and updates. And last but not least, Jigsaw has an employee assistance program, and basically with that, there's some nice benefits to that in terms of, for example, an employee can access up to 8 sessions of counselling for free within a year, and that can be done in your own time, and it's anonymous, and it's just a nice little bit of extra support beyond your direct work within Jigsaw. And you can find out more about that as well. And when you join, it's all laid out by the HR team in Jigsaw. So next step. So hopefully you are interested in applying for a job in Jigsaw. And if so, we are running a big national recruitment campaign at the moment. The vacancies are listed on jigsaw.ie, so you can find that out there if you wish, jigsaw.ie/careers. You will definitely see there's 2 national recruitment campaigns at the moment. One is for Jigsaw Clinician and one is for Senior Jigsaw Clinician. You will also see other roles advertised as they come up on a kind of bespoke basis. As I said, there may be clinical manager posts there from time to time. So definitely good to keep an eye on the website there if you have an interest in a career in Jigsaw. The closing date for this current recruitment campaign is Thursday, the 10th of March at 5 p.m. You need to apply by online application through the portal. So you'll see when you log in there, you click into it and it'll bring you to apply from there. You don't submit CVs, they won't be accepted. And the expectations that first round interviews will take place between the 28th of March to the 7th of April 2022. So I believe they're going to take part over Zoom. And so that's a little bit of a layout of the next steps. As I said, if you go to the website, you'll get a job description for all these things, so that if there was any questions that this presentation didn't answer, you should be able to find that within the job description. And thank you very much, and best of luck with your application.